see that it's working, hopefully. So, like you said, thank you for coming for this preventive medicine panel. It's a collaboration between 4 entities. So Tour for Diversity in Medicine, the Student National Medical Association, the Latino Medical Student Association, and the American College of Preventive Medicine. And our panelists today will be Dr. Maria Mora Pinzon from University of Wisconsin, Dr. Karen Studer from Loma Linda University Health, and me, Dr. Sylvia Caswell. And so I'll just give a few minutes for each of the physicians to introduce themselves. And then so we'll have Dr. Pinzon go first, Dr. Studer go second, and I'll go third.
Thank you so much. Well, for starters, I'm a preventive medicine physician. That means many things I'm going to talk about today. What are the possible options? But I would like to start saying the world is your oyster. One of the main things you will see today, and as you know more people in preventive medicine, is that each of us has a different career path and different interests, and we do different things. I work mostly in academia. I do research, but I do community-based participatory research, which means that I use a lot of community engagement and outreach to do implementation science and clinical trials to improve the health and access to healthcare services for Latino older adults. And in the University of Wisconsin, and at the end of the presentation, I'll share my contact information for anybody that would wish to talk more.
Great. Hello, everyone. My name's Dr. Karen Studer, and I found out about preventive medicine early on, which was super lucky and unusual in our field that I'm finding. I did my master's degree in public health first, and then I decided to go into medicine because I saw these amazing jobs that required both an MD and an MPH. And then when I was in medical school, I found my people. I found this whole group of people called preventive medicine physicians that also had this combination of expertise. And I knew that's really what I wanted to do. I do a lot of different things in my day-to-day job, which I love, as well as being a program director. I have a clinic at an FQHC where I practice lifestyle medicine. So I do that 1 day a week. I have a grant that I manage, which is about 1 day a week. I teach for the School of Public Health, which all of our residents will take that course that I teach. So I get to interact more with the residents in that way. I teach medical students, and I feel like I'm missing something. Sylvia, what else do I do? Oh, lifestyle medicine, that's what it is. I knew there was something else. The lifestyle medicine residency curriculum, I'm very involved in that, and that's sort of the other hat I wear. And so I'm director of quality and evaluation for that lifestyle medicine residency curriculum, which is a nationwide curriculum that any residency program can implement. And we are across the nation. We have over 1,000 residents participating this year. And so that is the other part of my my job hats that I wear. And like Dr. Mora said, the world is your oyster. With preventive medicine, you can really make your own job description and really be innovative in what you want to do with your degree and what your expertise is in. And if you want to do research, you can go that route. If you want to do clinical, you can do that route. And then there's everything in between. So I have a lot of residents that have graduated from my program that have done a lot of very different things. And I think that's the beauty of our field. Thanks.
Thank you so much, both of you. Yeah, Dr. Studer is my program director. She does have a zillion hats and is amazing at what she does. So I am Sylvia Caswell. I am chief resident of the Preventive Medicine residency program at Loma Linda University Health here in Loma Linda, California. I was fortunate enough to find out about preventive medicine in medical school, and I kind of had a backwards situation where I actually found out about the American College of Lifestyle Medicine first, and then I found out about preventive medicine when I was the president of the lifestyle medicine interest group at my medical school. And so it was through that I found out preventive medicine was a residency and it was a thing. And I was just really excited that that was what I wanted to do. And so typically preventive medicine I call it an incidental finding for most people. So for those of you who are, medical students that are finding out now, like that's very fortunate. But for most people, it's an incidental finding. They don't find out about it until way after the fact. And so there's different ways to do preventive medicine. So I'm in my last year of training. I did 1 year of training in family medicine and then had a gap year in there, waiting to get my spot here. And this has been the dream spot. And I'm so happy that I've had, the opportunity to come here and train here, as we are the hub for lifestyle medicine, I believe. So we'll definitely talk about the ways in which you can get into preventive medicine in just a little bit. So let me go to the next screen. So a lot of people don't even know what preventive medicine is. In fact, I talked to a lot of attending physicians who are like, oh, what are you doing? Like, what is preventive medicine? Like, they have no clue that we exist. And so what we do is that we promote prevention and health to improve well-being of individuals and populations. So a cool thing about preventive medicine is that you're working at that junction between treating patients one-on-one and doing clinical care, and also taking care of populations, which I think is really, really cool. Our specialty is recognized by the American Board of Medical Specialties, so we are for real. Unlike some people will say the opposite. But yeah, we do take boards at the end. And you can be an MD or a DO as a preventive medicine physician, and we're board certified, like I said. So there are 3 ways that you can do preventive medicine. All of us on this panel today do general preventive medicine and public health. And that's typically where a lot of people will mostly go towards that one. I think it's the most popular, maybe in a way. There's also aerospace medicine, and people don't also realize that exists, but it sure does. And at the end of this presentation, I'll put the link for that organization. But aerospace medicine is a lot of the people going into that are in the military. So if you're in the military, that might be of interest, but they're doing with a lot of extreme environments and just learning the physiological changes that happen in those environments. So they're mostly dealing with that. And then we have occupational medicine as well on my program, or my Loma Linda University Health has an occupational medicine program. So these doctors are doing a lot of clinical work, dealing with employees and occupational hazards and injuries and things along those lines. So it's more on the clinical aspect. But you're certainly dealing with environmental things in those things. So there are 3 ways you can do preventive medicine. So career paths in preventive medicine, like I said, you can be an MD or DO. We have expertise. So we're very broad spectrum in the way that we do our work. So it really depends on what your interests are and where you're going to get a job. So you can work at a hospital, you can work for the government, all the way at the federal level, like Department of Health and Human Services, NIH, CDC, all the way down to a local level, like a county health department, for example. You can work for the military. When you look at jobs, like there's a lot of preventive medicine officers that they want, or you can do aerospace medicine there. You can work for laboratories and doing research, like Dr. Mara Pinzon, she does that. And then you can work for healthcare organizations and private businesses where they're wanting more of the very broad spectrum expertise that we bring to the table. because we can work on, on the clinical settings and also the population settings. So we know a lot about biostatistics and epidemiology and managing healthcare organizations. So we do a lot of like leadership training to be able to be at these higher roles. And in research, like I said, and in prevention, in various clinical settings. And then we're also taking into consideration like social determinants of health and how that applies at the population level. So careers like here at the bottom, so like you can go into epidemiology. So we'll talk about an MPH here in a second, but that's something that we learn a lot about. And so you can go and do public health surveillance specialty work, or you can be a disaster epidemiologist, or you can be a researcher. You can do infectious disease. So if you wanted to work at a public health department, you can manage the tuberculosis program for the county and run a TB clinic. Or if you wanted to do environmental health, you can do things with pollution and, like asthma and things along those lines. You can do behavioral and mental health. Some people choose to do addiction medicine because that is very preventive. So they like to do that. In fact, I just did like 3 months in substance use disorder clinic, which was, I learned a lot. And then we do a lot of biostatistics, which is also something you learn a lot about in your MPH. I think it goes a lot in detail, more than med school does. And so you really get good at dealing with research and studies and how to interpret data and things along those lines. And then clinical preventive medicine and lifestyle medicine, we deal with that a lot in my program. So we do lifestyle medicine, obesity medicine, chronic disease management. We can learn how to really apply that foundational first line for, hypertension treatment, diabetes treatment. Like we learn how to do motivational interviewing. So you get really good at managing people one-on-one from that sense. And then you can also do health systems management. So like public health officer, county, state health officials, QI officers to do patient safety in a hospital setting. There's various ways that you can apply, your expertise within healthcare organizations to deal with those specific populations that these hospitals see. So there's definitely, like I said, again, broad spectrum. Just depends on what your interests are to apply what you learn in training and out when you work afterwards. So competencies that we focus on during preventive medicine training, I kind of already talked about these. So we apply biostats principles and methodology when we're doing research and conducting studies. We recognize epidemiological principles and methodology. So we learn a lot about epidemiology. There's an excellent book that a lot of us learn from to learn more about epidemiology, because I don't think that we get a whole lot of that in medical school. And then we do planning, administration, and evaluation of health and medical programs and evaluation of outcomes of health behavior and medical care. So we get quite a bit of training in evaluation and, like running PDSA cycles and like managing public health programs. Like we learn how to do all those things. We also recognize, assess, and control environmental hazards to health, including those of occupational environment. So even though, like, let's say you're doing a general preventive medicine program, you'll still have to learn a lot of the concepts that the folks in occupational medicine learn, because those are still very preventive in their nature. We also recognize the social, culture, and behavioral factors that play a role in medicine, which is not something that we learn a lot about, again, in medical school. So learning the social determinants of health and how they affect health at an individual and also population standpoint, and how those can be tied in to the clinical setting and how we think about people. Because, you know, like, let's say we're trying to get people to lower their blood pressure because they have hypertension and they're on 2 different antihypertensives. Like, maybe they don't have access to healthy food. Maybe they don't have a safe neighborhood to be able to go walk. And maybe they don't have transportation to be able to get them to the grocery store to buy, you know, like fresh fruits and vegetables that we would ideally want. So they're relying a lot on canned foods, which are high in sodium. So we think about these things and trying to facilitate, you know, like, what is it that you need to be able to accomplish your goals medically. And then we apply and evaluate primary, secondary, and tertiary prevention, which are all the levels of prevention, with variations based on preventive medicine specialty. So wherever specialty you're doing within preventive medicine, we apply those 3 levels in everything that we do. And then we do an assessment of population and individual health needs. Like I said, we're working right at that junction that can work with both levels. So when we do preventive medicine, we have to have a master's of public health before we can sit for boards. So it is not required to have an MPH before you come into preventive medicine. Although we do have people that will apply and they already have it, but that's because they've always been geared that way. And so they're coming into preventive medicine like that, just, it's kind of like coming full circle for them. But if it's not necessary for you to have an MPH, so a lot of programs will offer your MPH at no cost to you while you're in preventive medicine programs. So the way that I did it was that once I had my spot for preventive medicine, then you still have to go through like the paperwork and submitting documentation stuff and like transcripts for the School of Public Health. But you have your spot also for your MPH, and then you'll have time in residency to be able to work on those MPH classes. So here they make it really, really nice. It works synergistically with your residency training. So while you're learning things in your MPH, you're also applying them at the same time. So for example, like learning a lot about epidemiology and like learn how to conduct studies, like you apply that into like QI projects. So it works very synergistically. And then at the end of residency, you finish with you complete your residency and you also finish with your MPH. So you have another graduation. So kind of nice. And by the way, if any of the panelists want to stop me at any time, and if you have any additional comments you want to make, please feel free to do so. Road into preventive medicine residency. So you cannot start preventive medicine right out of medical school. So it starts as a PGY2 position. So you have to have 1 year of training in something else. So some people will do like a PGY1 or like a transitional year in any specialty. So they'll come in as a TY, or maybe they'll do a different specialty and they didn't like it. So that was my case. I started family medicine, and that specialty was not right for me, even though the program was amazing. So I finished my PGY1 in family medicine, and then started my PGY2 in preventive medicine. So some people can do it like that. Some people do their TY year and they know they just want to do preventive medicine. So, call it a day. So you need to apply to so PrevMed doesn't start until after that PGY1. So that's the key. You can come in after you've completed another ACGME accredited residency. So like, let's say you did internal medicine and you wanted to come in and do preventive medicine, you totally can. So you can come in most of the time, like if you're finishing up your residency, that last year is when you apply. And then you've got your 2 years afterwards while you're doing, if you don't have an MPH, then you have that. Now, my program, and I'll let Dr. Studer talk about the +1 system that we have here now that's relatively new. But that's basically, you only have 1 year of preventive medicine after completing another ACGME accredited residency. And then the last point was, if a career change decision is made, apply with at least 1 year of training from another program. And you can even be practicing as an attending. And some people are interested. In fact, one of my co-residents, he was emergency medicine and he practiced for a few years before he came in. So you don't have to necessarily like bridge right after. You can totally, we welcome everybody that has an interest. So
there's an interesting exception to everything that Dr. Caswell said. And I think we at Loma Linda are the only one that I know of in the country that does that. And you can apply to our specific transitional year preventive medicine spot. And we only have one, which is something I'm trying to increase as the more people realize that we are a specialty and they want that PGY1 position. So like I said, it's only one spot, and I think it's the only exception in the country that I know of that has a specific preventive medicine transitional year spot, and then you automatically come to our program as a PGY2. That would be an encouragement to any MS4s out there who want to do preventive medicine, and you know that already. I would invite you to apply.
that's perfect. Thank you so much for explaining that exception. Yes, we do have that one. All right, next, so preventive medicine programs. So there are 72 preventive medicine programs located through the United States. And that's between general preventive medicine and public health, aerospace medicine, and occupational medicine. And then so some of the general preventive medicine programs are combined formats with primary care residency programs like family medicine or internal medicine, and they're throughout the country. We used to have a combined family medicine, preventive medicine program, but we no longer have that, which is why I'll let Dr. Studer talk about that +1 that I was saying earlier. But generally speaking, there are programs in the country that will have a combined. So what ends up happening is that your training ends up being over 4 years. And you're still doing your MPH through it. I'm not entirely sure how every program does, because there might be tiny little details that might vary from program to program. So what I recommend is that if you're wanting to do preventive medicine and you're thinking about doing a combined program, like just right off the bat, you should contact every program in the country to just obtain more information. Sometimes the websites aren't updated as often as they should. So you should definitely contact every program. I know Dr. Pinzon raised her hand.
I would like to emphasize something also related to doing the research. There are 72 preventive medicine programs. They are very different 72 preventive medicine programs. Depending on depending on what you want to do, there are programs better suited to give you that experience and the mentorship that you need. And I really like to emphasize that. It's not like, oh, I'm going to be a cardiologist. No matter where I go, I will get the same training. Preventive medicine is not the same way. So we have some programs that are based at public health departments. If your goal is to work at a public health department, you should go to one of those programs. If your goal is to do mostly lifestyle medicine, you should go to Loma Linda. That's my first recommendation. But at least look in the other programs, where could you get that expertise? We don't have a set pathway. We don't have like you go from A to B to C. Most of the time you need the mentorship and see people doing what you want to do in order to be able to do it after graduation. If you say, oh, I would like to go to a program where I do global health, or after graduation, I want to do global health, but you never work with anybody in global health, it's going to be very hard to get into the field. So each program is different, and you should really look, if you're interested in preventive medicine, you should really look and define what you want and who is doing that at every program. I think the interview season always gives you a very good opportunity to look and talk to people and see what is the best fit, not only for hey, where's the weather? Where's the location? What's the benefits of the hospital? But also, what are the attendings doing at this program? Is that something that I want to do in the future? 2 years goes very, very fast. So it's really maximizing your experience by being in a program where you will be getting the skills that you need to do the next step. So I wanted to emphasize that.
No, that's a great point, and I'm really glad that you brought this up, because that is also what I considered when I was applying myself. Because I did look at 2 state-run preventive medicine departments, one in Florida and one through Texas, and they were both good programs, but I really wanted lifestyle medicine. Like, that's always been the dream, and I knew that I would get outstanding lifestyle medicine training at Loma Linda, because we're like the mecca basically of lifestyle medicine. So like, for me, it was always a dream, like, I'm gonna go there because I want to get that lifestyle medicine training. But if you wanted to do more epidemiology, like you want to look at other programs like UNC, Johns Hopkins, like, they're gonna have solid programs there. So it's a matter of your interest for sure, and in contacting those programs and seeing what they're doing there, to get the training tailored to exactly what your needs are. And then the last point I wanted to make is that, so we don't go through the NRMP match per se. So over 3/4 of the programs participate in the standardized acceptance process matching program. And so you still put in your stuff through ERAS, but then you go through the SAP, and that's in mid-February of each year. And it's a relatively new system, but that's how we can get some of the people coming into preventive medicine, is at that mid-February match.
And I'll just add a little bit more about the SAP. All of the programs are participating unless they have some financial reasons why they can't. And then I think the only exception is the military match is separate. But otherwise, all of the programs are now participating, or it's very, very close to all. And that is kind of the updated process. And I forgot what else I was going to say, but if I think about it, I'll chime in later.
No problem. Thank you for that. Yeah, the last number I saw was over 3/4 of the program. So I'm glad that most of them are in now. But yeah, military match, that's correct. Yeah, they have their own separate thing. Good. So we're getting to the end here. We're right on time. So I just put up some resources. American College of Preventive Medicine is like the big one. I'll definitely go on there and look at their resources and prospective residents to learn more information about the SAP and how that works. And then you can also, there's a list on there too, that I actually put in this PowerPoint, but it has the list of the 72 programs, but it was last updated last year. So it's not fully updated, but it is as close as possible. Oh, thank you, Dr. Mora, for putting your information in the chat for people. That's super helpful. I'll put mine on there as well. And then the American College of Occupational Environmental Medicine is up on there. The Aerospace Medical Association is on there. And then the American College of Lifestyle Medicine is also on there, just for convenience, for the sake of convenience. Let's see, Dr. Studer also put her email in the chat. And so what we'll do now, let me just fast forward. So now we got to Q&A. So we have a question for the panelists. Do you apply transitional year through SAP too?
That's a great question. Yeah, I'll go ahead and take that one, because we do use the NRMP match for our one transitional year spot in preventive medicine at Loma Linda. And again, that's very unique, and we are different. And so that is probably the only program, at least that I know of right now, that does it that way. And so that one is through the match, and then you automatically matriculate into our general preventive medicine program after that. So we do have something listed. We've got Loma Linda, regular transitional year, and Loma Linda is specific preventive medicine year. So make sure you differentiate. You can apply to both, of course, but the one that will catch my attention is the one that says preventive medicine. So that is the one thing. If you're coming to us as a PGY1, you're applying as an intern, then everyone pretty much goes through the SAP with few exceptions, but because of funding. Oh, I know what I was going to say. We use the same algorithm as the match. So ACPM runs the SAP for us, and we have done it computerized as well as in by hand. And so they make sure everything is really accurate. And so we've been doing it for, I think, 3 or 4 years now, and we've gotten it really fine-tuned, and bless the people at ACPM for helping us do that. And it's no cost for you to sign up to participate. The programs put up all the cost of it, so there's no cost to the applicants.
And also there's no cost for applying to more programs. Difference to the NRMP match that you need to pay per program. There's no, you can apply to all the 72 preventive medicine programs, and there's not going to be more than more money. It's just a little different. One thing I wanted to add is that just emphasis on something that Sylvia said. You apply during your intern year. That means that you go transitional year, preliminary positions through the NRMP match regularly. And then you come, while you're doing your intern year, then you start applying for preventive medicine. If you tell this to your advisors in medical school, they will tell you that you are crazy. How is that possible? You are jumping into the unknown. That's not true. I want to say preventive medicine is very friendly. It is not something that you will, the chances to match are very extremely low. We usually actually have positions open. I think the main thing is, where do you want to practice? What type of work do you want to do? Certain spots are more competitive than others. But if you want to do preventive medicine, doing your intern year in any specialty, any city, wherever you want to go, that's fine. And I think you can talk to us about how to make sure that your CV is ready for when you're ready for apply for preventive medicine. But I do not want you to feel that it's jumping into the unknown. There's plenty of spots available, but also there's 100 different career opportunities. So we can talk more about what to make sure that you get the best training that you can, that you want in your career.
Perfect. Thank you for answering that. I have 2 questions that I know that I get asked a lot when I'm talking to potential residents that are looking into switching from their current specialty to preventive medicine. The first question is, how competitive is preventive medicine?
Yeah, I think you answered that very well just now, but I would say it depends on the program, because some programs are a little bit more competitive than others because they're in a desirable location, or since there's a lot of people who want it and there's only 1 or 2 positions. So programs with a fewer numbers in desired locations or like bigger names may be a little bit more competitive. But like my colleague was talking about, that usually anyone who wants to do preventive medicine can do preventive medicine if they have a solid background in CV. And occasionally, I say every year we usually have a few unfilled spots. So as long as you are a solid candidate, there's a spot for you in preventive medicine. At this point, hopefully we'll change that and we'll need to grow our spots in the future. But for right now, it's still a little known gem.
And I think that's the thing, is that when you hear there are available spots, you might be thinking, oh, so nobody wants it. Is that nobody knows about us. That's the main thing.
Yeah.
We get, and Sylvia mentioned this, we get a lot of people that already did another specialty and they were not satisfied. They didn't know what to do. I did 2 years of general surgery. And I went to general surgery. Yes, this is what I want to do. But at the end, when I look back, it's like, yeah, it was really never my thing. preventive medicine is my thing and my people, as Dr. Stutter mentioned before. So we have spots available, but in part it's because a lot of people don't know about us. And it's harder to make the transition to another residency once you'll be practicing with an attending salary after 5-10 years. So that's another reason why some people that's interested and want to do it, they might not come to us. I want to just do. So if you're here, you're already ahead of the curve.
Yeah, no, that's great. Those are great points. I appreciate you sharing those. Vaguely speaking, what, and this is the second question I get a lot, is like, how can I show my interest in preventive medicine if it's such a broad spectrum? Like, what do I focus on to make my CV look good, to be able to get accepted?
Well, I think one of the first things I look for is if they're a member of ACPM, because that's going to signal to me that they're interested, and especially if they attend the meeting, because I know that it takes a lot of time and energy, and sometimes it's really hard to afford as a medical student. So if they come to our meeting and they connect with us there, then I think they're really serious about this, going into this field. The second thing is make it very clear in your personal statement. If you don't mention preventive medicine, or if you say preventative medicine, it's going to signal to me that you're not really that familiar with our field. So that is a little gem that I will throw out there to all of you on the webinar.
That's a great point.
I would like to build on that, on the personal statement. If the personal statement does not reflect what the future you want, it's very hard for me to really understand. Do you really know what preventive medicine is? What are the options? I've seen personal statements that are, I want to take care of patients and very clinic focused, but that's it. And I say, okay, but how the preventive medicine training will help you to do that? And making a little bit of that connection, that you understand what we do or what we could do or how this specialty can help you get there. As some people say, oh, do I need to have rotations in public health and other things? Although it would be great, we know that you probably didn't know that was an option. So usually it's about that personal statement reflecting what you want to do in the future, how the training in preventive medicine will help you get there. And also tell us a little bit of your story, if the sense that, oh, I was doing surgery, why did you change? I was doing pediatrics, what is something that calls your attention? I mean, among the main things that people mention that I say, oh, they understand what's preventive medicine is when they're talking about the community level, when they're talking about populations, when they're talking about, I want to change the shift and I want to do lifestyle medicine. I want to do a little bit more on the ahead of the prevention side. Oh, they understand what we do. So that's the thing, the main thing that I look for, that the personal statement that tells me, why are you even here at this point? Because again, you might have heard about us just a month ago, and your CV might not have 3 preventive medicine rotations or public health rotations, but that story is that what tells me, oh, let's talk about more with that person. Let's see, how can we help them to get there?
Yeah, no, I agree with that. I also look to see what their story is and to see what they've worked on. Because the thing is, like, you don't know it existed, just like you said. You know, like, how do you, like, you probably did not have a preventive medicine rotation, and so it's hard. But it's the story that really, you know, that will show, that will highlight why you're even coming to us. So to kind of go off that point, then getting letters of recommendation sometimes can be tough for people coming into preventive medicine. So what are some ways that they can, like, what are you looking for in letters of recommendation for preventive medicine?
Yeah, it's another really common question that I get too, because a lot of medical students will really worry, like, I don't have a preventive medicine physician that I can get a letter from. That's totally fine. What I look for in the letter is solid foundational skills, emotional intelligence. Can you communicate well? Do you have a solid clinical background, so that, you know, as you go into preventive medicine, that you're going to have that solid fund of knowledge? if things arise in your patient care, especially for my program. So I'm looking for those foundational skills that every physician should have and be able to master. So I would say get the letter from the person who knows you the best, who's worked with you the most. And for me, I do necessarily have to have someone from preventive medicine because I know that can be hard. That being said, if you know you want to do preventive medicine, rotating somewhere is always a great opportunity to have at least one letter from them. That would even bolster your application even more. And then I'll also talk about the +1. I realized I didn't mention more about that. So before we end, we can come back to the +1 option.
Okay, that sounds great.
I'll let Dr. Pinzon go next about the letters.
Nothing. I 100% agree. The person that knows you the most that can tell us about how good you are with patients, with teamwork, with other people. How can you communicate? If it's a program director from the previous, for your previous program when you did your residency, just making sure that it reflects your clinical skills. That's I think the main thing. And I've seen good letters that actually have nothing about medicine, but they talk about public health and your public health experience, or about your research or other activities, or getting stakeholders involved, a lot of community work. Those are letters that speak to my heart because that's what I do. So they're letters that are not from physicians, and many times are for PhDs, public health providers, or somebody else that have worked with you. So don't feel that you need to be restricted to physicians. We need to see the clinical skills. Don't get me wrong. You need to have a clinical letter. But if you have a good letter from somebody that's not a physician, that also helps a lot.
Yeah, it's a great point. I'll also add that if you are coming from a different specialty, well, even your TY, one of your letters has to be a program director letter. At least that's the rule at our institution. And so I'm assuming that's very similar across the country, where your program director has to write you a letter. So say you are in family medicine, you need to have that talk with them early on that it's not the career choice for you and that they need to write a letter for you. So you can't kind of see what happens with Prev Med, and then if you don't get into Prev Med, stay in family medicine. It won't work out that way because you have to let your program director know. And so you do need one of your letters to be from your current or past program director. And if you did 2 different programs in the past, I need a letter from each program director. So that would take up 2 of the potentially 4 that you can upload.
Thank you for clarifying that. That's important. And then now that I'm chief, when I'm reading, because I read through all of them, like sometimes, when they're switching from another specialty, like maybe they did, I don't know, general surgery or whatnot, like sometimes it's hard to see because they're just so busy, but they may have been involved in projects. So like QI projects, or they may have been involved in the community in some way and they had projects that way. So like, I'll look for those too, because they'll help me understand that, what their passion is about preventive medicine. So that's another thing that you can always work on too, to show your interest. If you don't have like a specific, if you don't have access to a preventive medicine rotation, which is my next question and final question before we talk about that +1. So typically students will use some of their sub-internship rotations, like their audition rotations, but the pandemic kind of threw a wrench in that where people couldn't go audition. And preventive medicine is not a rotation that you could get anywhere. Like, for example, as a medical student, I tried 3 different counties to go rotate in public health department and they all shut me down. So like I never had an actual preventive medicine rotation in medical school. So how are programs giving students outside of their own programs an opportunity to come in and do an audition rotation?
So we have an opportunity through VSAS, and so any medical student can apply. I will add the caveat that if you're a DO student, we have a COMLEX score cutoff to be able to rotate with us, and that is fairly fills up quickly. So if you want to do a rotation with us here at Loma Linda, we're happy to have you, but get your VSAS in quickly so we can get your date solidified. I think the CDC might have some opportunities for electives. I know one of my past residents had rotated there, and then she was very creative and also kind of said, hey, can I create my own elective? And our medical school allowed her to do that. So sometimes creativity can go a long way, and asking for things that you may not have thought of to ask for. And I'm not sure about other programs across the country that might have elective opportunities, but it never hurts to reach out to the programs that you're interested in and ask, like, hey, can I come rotate with you?
Yeah, I wanted to say specific also that many programs they have like a curriculum or opportunity, but they might not be advertised in visas and other places. So send an email, ask. And this also apply to already graduates. I know somebody that might be seeing this that wants to change career. Hey, send an email and ask, hey, is there any chance that I can work with you, see what is preventive medicine? Because there's opportunities out there, but if you don't ask, you might not find them.
Exactly. Very good. Thank you so much. Dr. Studer, do you want to take a few minutes and just talk about the +1 that we have here?
Yeah, I'd love to tell everyone a little bit more about that because it's a new way to do a combined program. The rules of preventive medicine from this committee called the Review Committee from ACGME kind of comes up with these guidelines. And so they said if someone has one whole residency that's under their belt, plus at least half of an MPH or more, they can do preventive medicine in 1 year. And so our program switched out from doing the combined family and PrevMed 4-year combo program to this new method. So now anyone can do this and combine it. So we've got people combining emergency medicine, OB-GYN, PM&R, family medicine, internal medicine. So now it's really opened the doors a little bit more. And the way we do that is we ask for people who are interested either at Loma Linda or outside of Loma Linda to let us know of their interest during their PGY 1 year. And then they apply to this +1 position. And we have an ERIS application that says +1. And then if you'd like to combine that with your current thing, you apply to that. We interview you and then we accept you into that spot that's in the future. And while you are waiting for that spot and while you're finishing up your first residency, you work a little bit on your MPH, which is all online and asynchronous. Now, it gets a little tricky with the funding. If you're at Loma Linda, the first half of that MPH is totally paid for. If you're outside of Loma Linda, say you're a resident in Florida and you want to do this pathway, that's totally fine. But you'd have to pay for the first half of the MPH because you're not an employee of Loma Linda yet. Once you come to us in that final year, then the MPH is fully funded for that second half. Or if you already have an MPH, you can just plan to come for that 1 year, still contact us so we can save your spot. And that's an easy way to become board eligible in preventive medicine. And I've got 5 major tracks that we focus in on because it's hard to squeeze what you learn in 2 years into 1 year. So we have these different foci. So we have lifestyle medicine, global service, quality improvement, maternal health to reduce maternal mortality. And I'd like to add an obesity medicine track. So let me know if you have any questions about that. Please feel free to reach out to me.
Thank you so much for explaining that. I think it's so nice to be able to have all these options to come into preventive medicine, and everybody they come from such, like diverse backgrounds. And so it's really nice, even when we're in didactics, even like everybody has just such a interesting, like the way that they've trained before. Everybody has great contributions in didactics. I've always enjoyed our didactics in preventive medicine. So to respect everybody's time, we have about 5 minutes. I just wanted to give our panelists just a couple minutes of any final remarks you wanted to make, and then we will stop the panel.
I think I would like to say, if you're interested in preventive medicine, it's okay if you go to any other specialty. You can come back to us in the future. You can do this as a sort of a fellowship after you finish another residency. Like Dr. Studer mentioned, the +1 is an option, and I think other programs are trying to implement that in the future. So don't feel that you're missing the opportunity and this is no longer available if you do something else. We will always be here for you. If you're interested to start to do something different with your career, we also have several educational programs. Come to our conferences. We have scholarships to attend the conference. Right now, for example, the ACPM just launched a new curriculum. It's about the 10 skills for practice in public health. So if you have another specialty and you want to start working in public health, we have the tools to help you in that transition to your career. Look in the ACPN website, American College of Preventive Medicine. Find me on Twitter, Maria C. Mora, and we can always help you to make your career what you want to see. The world is your oyster. Don't feel that you will be having just to do clinic 9 to 5, and that will be the rest of your life. You can really incorporate many things being in preventive medicine.
Yeah, I would just echo what you said. I think in general, we're a very friendly specialty, and we have a really great work-life balance. I don't take call. I don't work nights or weekends unless it's my choice. And so it's a really great, it's a great fit for a lot of people who know, like me, that they need lots of sleep and they're not going to be up all night on call. So it's a great work-life balance. It's a hidden gem. It's very family friendly. We have flexible work hours in our program. I'm sure others do too. You can really make it what you want. There's elective time to really fine-tune your career goals and get you connected. And if you're not a great fit for my program, I will help you find a program that is a good fit. So just because you're not interested maybe in lifestyle medicine necessarily, I'm still happy to talk to you and try to find a really great program that fits your needs.
Thank you so much. Just a couple of things I wanted to say. Yes, coming into preventive medicine as a resident, you don't take call. You don't have a call pager. In fact, like they gave me at the GME office, they gave me one, and I was like, oh, I don't think we're supposed to have these. They're like, oh yeah, that's right, you're not supposed to. And I think they have like 57 specialties here or something like that. So yeah, it's really nice. No call, no weekends, no holidays. Depending on what holidays your institution observes. But it's nice to not have to work overnights. So as a resident, even though you have the MPH that you have to work in, it still feels much better controlled than when I was in a different specialty. I felt like I had much more control of my time. And the fact that I didn't have to be doing overnights and things like that just really helps. And preventive medicine is, very focused on wellness in general, because you're trying to emphasize prevention. And so, programs are really good about, making sure everybody's good. At least that's how it is here. And so I'm very thankful for that. So like I said, thank you so much, Dr. Studer, Dr. Pinzon, for being on this panel with me. I really appreciate it. And a special thanks to Dr. Matthews for facilitating this. And I do not see any other questions. So we will stop recording, and I hope everybody has a great rest of your weekend.
Thank you so